Welcome to HIMS TV. My name is Dylan Yogendra. I'm the managing editor at HIMS EMEA. Today, I'm delighted to have with me Dr. Zakiuddin Ahmed, project consultant Raha at King Saud University and CEO at Digital Care. Dr. Zaki, can you give us a background to your role, please?
Sure. Thank you very much. First of all, I would like to thank you and HIMS for giving me the opportunity to be part of the HIMS conference again this year, albeit virtual, but still I think it's exciting to at least have the conference and then the opportunity to say a few words on my role and the work we do in digital health. You know, as a physician, I've been working in telemedicine and digital health for more than 2 decades now. And my association with King Saud University for this project, which is a connected health model, first of its kind, which is completely integrated. And we have all the different technologies, telemedicine, IoT, medical devices, video conferencing, web conferencing, etc. Everything is kind of like integrated and bundled into this. So that's something which I love to talk about. We have published that project and some other projects which we have been involved in the last 4 or 5 years, essentially, and obviously during the COVID-19 phase, which really provided a tipping point for health and IT and telemedicine.
Can you tell us a little bit about your experience of COVID-19 and how it's actually perhaps acted as a catalyst for digital transformation, please?
As I mentioned, I've spent a fairly long time working in telemedicine, and especially where I come from, originally Pakistan, we have been struggling like other countries, but much more than others in utilizing telemedicine or utilizing technology for patient care. And it's been a very long journey, but as we all appreciate and as we all realize, that COVID-19 provided telemedicine an opportunity to prove itself, to prove the value proposition and the uptake or the appetite of telemedicine increased a lot. And similarly in Pakistan, which was hit by COVID as early as middle of March, and we also faced our share of lockdown. So as soon as our lockdown started in Pakistan, I think within 2 days, I at least working with my colleagues and some associations, we launched a nationwide telemedicine / medical call center helpline where we had some dedicated physicians offering video conferencing based, software based teleconsultation to anyone calling from anywhere in the country. This basic medical call center was supported by more than 100 specialists, all were volunteers who were actually during the lockdown, they were not doing any clinics and they were also at home. So patients, all of the patients were home because there were no clinics. All the physicians were at home, except the selected hospitals which were actually accepting COVID patients. So we kind of connected those physicians and patients on a national level through this service. So similarly, the government of Pakistan also utilized that opportunity, and different other organizations. So we all in Pakistan kind of launched our various telemedicine or medical call center services. So I think that was opportunity, not only helping the patients, but helping people like us who have been advocating telemedicine for more than 2 decades, that it really works. And then we saw, in the US, that the President Trump, actually, he invoked the Medicare 1135 waiver, allowing more and more telemedicine to take place, lowering the bar, if I may call it, and so much so that physicians receiving calls from patients on the telephone, they were also being reimbursed. So I think that really helped in the tipping point. And if you go to UAE, as we all know, that in the last, at least in the last decade, people like us, we've really tried to push telemedicine in UAE. But for one or the other reason, we were really not so successful as we should have been. But just because of telemedicine, all of a sudden, one fine morning, if I may call that, the government decided that, okay, we will start telemedicine, and the regulations were eased off, and we had telemedicine. So I believe that not only larger initiatives by organizations like us uh, help telemedicine, but individual doctors. So only my company and the group I work with, we provided more than 150 physicians in Pakistan with telemedicine software and telemedicine apps so that they could do teleconsultation with their own patients. So this is just one, I think, a few examples of the multiple digital health initiatives which kind of emerged from this opportunity, which obviously brought a lot of challenges and tragedy for all of us.
Fantastic. I think you touched on so many pertinent points there, Dr. Zaki. I think the collaboration is actually really important, and that's something you've addressed in your response. I wonder if you can expand on the kind of the role of the patient and how important the patient is in terms of being at the centre of the care, centre of their care. Is that something you can talk a little bit more about, if possible, please, Dr. Zaki?
I would say that whenever, and if you have heard me talk in conferences, you will remember that one of my earlier slides is about patient centricity. And my other, responsibility, or if I can call it, my first love is digital health. But my second love, if you may, is patient safety and quality healthcare. And in that space, I actually established an institute, which is the first of its kind in the region. It is called RIFA, International Institute of Healthcare Improvement and Safety. And I'm also the chairman of the conference called International Conference on Patient Safety. So we talk a lot about patient centricity. I would like to mention that patient-centered care was actually mentioned and considered as a fundamental of healthcare by the Institute of Medicine report, which came out early as I think 2001 or 2002. The report is called Crossing the Quality Chasm, which came out after the first report, which is To Err is Human. So this second report of Institute of Medicine in the US actually laid down the fundamentals of healthcare. And for the first time, patient-centered care was mentioned as one of those fundamentals. And from there, I can say that the real journey of patient-centric healthcare started, which was again very strongly supported by British Medical Journal. BMJ brings out its journal as well, and the term partnering with patients was actually coined by BMJ, and they also supported the concept of keeping the patient in the center. So patient centricity actually expands on the older or at many a times existing, unfortunately, the disease-centric or physician-centric current model or the older model of healthcare. So we are working to actually shift and transform from the disease-centric or the physician-centric model to a patient-centric model, where we could actually bring patients and maybe we can call them prosumers, not consumers, but this is a new term which is called a prosumer, and it means that a person who is involved, who is respected enough to be involved in developing or in the development of the solution which that person is going to use or consume. So with that as the backdrop, what we did was that we incorporated the concept of patient-centric healthcare in all our digital health projects, including RAHA, which is remotely accessible healthcare at home at King Saud University. And our first three objectives are patient engagement, patient education, and patient empowerment. So that's where the concept of the e-patient also emerges. And our telemedicine software is also very patient-centric. The processes, because it's developed by physicians themselves, so we focus a lot on patients, and we say that patients are at the center of all what we do.
I wonder if there's any countries, systems, or regions that you could kind of point to that you think that should be referenced and can be learned from.
I have a lot of respect for Saudi Arabia, not only because Saudi Arabia was one of the first countries in the world, or the earlier countries in the world, which moved to develop national e-health policy document. And as someone who was actually part of this initiative, by WHO and ITU to develop the toolkit for national e-health policy, it was really very encouraging to see Saudi Arabia conform and adopt or start working on the e-health policy. So I think that's a good starting point for me to respect a country where the Ministry of Health is so they're cognizant of the power of digital health and e-health. So that's the starting point. Then my involvement with King Saud University and the Ministry of Health, where they have a dedicated position for e-health, I think that also speaks volumes about their commitment and their conviction to e-health, telemedicine, and digital health. Their commitment to digital health is also seen when we see that they are trying to bring global digital health solutions into their country. We also worked on a project where we brought in artificial intelligence. Saudi Arabia is focusing a lot on primary care, and they've developed the recent model which they have developed is also reflective of that. So I think that, and then again, the world's largest tele-ICU network happens to be in Saudi Arabia at a private hospital network. So I would say that in my association and in my learning of Saudi Arabia, especially in the last 5 years, because I've spent time and developed the project at King Saud. But even before that, when I was interacting, I was asked to speak and working with the Ministry of Health. I think that's a country which I would like to follow and see, because health informatics is really they're driving this health informatics and digital health and becoming an example not only for the region but actually for the whole world with their stages which they have achieved. So I think that's a country which I would like to refer, and I do during my talks.
So I'd like to take this opportunity again to thank you so much for your time, Dr. Zaki. I know you're incredibly busy, and we look forward to learning more from you during the event.